My name's Rebecca Fry. I'm here to interview for your nurse opening.
Hi, I'm Megan. I'm the nurse director for the ICU. It's nice to meet you.
It's nice to meet you too. Thank you for having me today.
You're welcome, no problem. All right, I'm gonna just start off with asking you a few questions. So why are you interested in our organization?
So I actually started working for Innova about 3 years ago, and I've been a clinical technician too there on the stroke unit. And between my experience there and my clinicals time with Shenandoah University at Valley Health, I've just seen a lot of different type of nursing units and nursing experiences, and I really like what Innova has to offer and really their foundation and their basis for new grad nurses.
Okay, great. So this next question, I'm just gonna propose to you a little scenario and just get your response. So if you would walk into a stroke patient's room and find them to be unresponsive or a drastic change in baseline, what would you do first?
So I think it kind of depends on two things. If the patient's still breathing while I assess them and I see a change in their baseline, I would definitely go ahead and call the physician and update them on my assessment, while also calling for a rapid, so that way if they need to have a stat head CT or any other type of quick action treatment, they're already there. But if they're not breathing, then I would call for help and immediately start some resuscitative treatments needed. And of course, once I have more people there to help me and calling it MSET, I would then update the physician on what's going on as well.
Okay, great. So I want you to go ahead and describe a situation where you persuaded an individual or group to follow your course of action rather than their previously stated position.
I think that's actually a good one, because right now in COVID, we're finding a lot of patients are isolated because they're not able to have their family and their friends or support groups here with them to help advocate with them and make them feel more comfortable. So a major problem we see is that they're really scared, and with that they get frustrated. So they don't know how to handle expressing themselves or answering questions that are necessary for their treatment. And so something that's been big for me is pushing with my coworkers and with the patients about just taking 5 minutes and sitting with them and talking with them. That makes all the change. And so we could have a patient who has been against pain management treatment because they just aren't educated and they're scared. And so taking those 5 minutes to sit with them and educate them on what's going on and why it's super beneficial for them helps relieve their fears. They're expressing their concerns, and normally we can get them to find a middle ground where they'll get their treatment and still get their fears answered.
Okay, great. So next, I'm gonna ask if you'll tell me about an important goal that you set for yourself and how you were successful in achieving it.
So nursing school was a really big goal for me. I didn't have the financial stability when I first graduated from high school to go straight into a 4-year college, but I always knew I wanted to do nursing. So I made a game plan. I went to Northern Virginia Community College and got all my prereqs done, as well as I started working as a CNA. I went to the American Red Cross and got my training, and I started in assisted living. And so that way I was getting my foot in the door. And then after a few years of that, while still taking my courses, I got the opening at Innova on the stroking as a technician. And I continued doing that all the way until I got into the nursing program that I was happy with. And now I'm here with nursing.
Great, well I'm happy for you.
Thank you.
All right, so what challenges are you looking for in this position?
So I really want to be pushed whenever I start on the unit. I've seen a lot of stroke and neurology patients, but I haven't seen a lot of other things in a way that's challenged me as a nurse yet. And I really think that I want to go into a unit that's going to challenge me. I want to be pushed beyond my boundaries, and then I want to grow my foundation as a nurse. I want to be able to be well-rounded and continue going up from here.
Okay. And my last question is just, why do you want this job?
So for that exact reason, I really know that the ICU here will meet the needs that I'm looking for, and I know that I can bring a lot to the table as well. I think it will help me build up my skills and become well-rounded and help me build that foundation, as well as help me go further with my CCRN in the future. And I really want to be able to stay and grow here.
Okay, that's great. I think that's all the questions that I have for you right now. Is there anything that you would like to ask me?
Actually, yes, I was wondering what your average patient acuity is for nurse ratios.
Typically in the ICU, we are 1 to 2, or in some cases it's just 1 to 1.
Okay.
But we try to not go over 1 to 2 here.
Perfect. And then I was also wondering, with COVID going on, what you guys did in particular to help support your staff with all the scares.
So with our staff, we've been doing staff symptom checks before they are allowed on the floor to work for the day with patients. It involves temperature checks and questionnaires about who they've been around, or if they're around anyone who has symptoms or anything like that. We also offer free COVID testing for any of our staff that was exposed. And of course, we're providing the appropriate PPE to all staff. And we also make sure that we always have staff on call so that we're avoiding any short staffing during this time.
That's amazing. I really appreciate that. I think that's a really good one. Knowing that you provide the testing if exposed, that's a really great access to have.
Mm-hmm.
And then I just have one last question. What is your average start rate for new grad nurses?
So we typically start our new graduate nurses off at $29 an hour.
Perfect. All right. Well, I think that's all I have to ask.
All right. Great. Well, it was very nice meeting you, and we will get back to you soon.
Perfect. Thank you very much.
Thank you.
Have a great rest of your day.
Thanks. You too.